Hello and welcome. Today we're diving deep into a common heart condition called mitral valve prolapse, or MVP. We'll explore what it is, what causes it, how it affects the heart, and what can be done about it. Whether you've been recently diagnosed, know someone who is MVP, or are just curious, this video will provide a comprehensive overview. So, what exactly causes mitral valve prolapse? In many cases, the cause remains unknown, and it's believed to be related to genetic factors. This is called primary MVP. It's often linked to inherited conditions affecting connective tissue, like Marfan syndrome or Ehlers-Danlos syndrome. These disorders can weaken the valve leaflets and supporting structures. Secondary MVP, on the other hand, can be caused by other conditions such as rheumatic heart disease, ischemic heart disease, hypertrophic cardiomyopathy, or even certain autoimmune disorders. These conditions can damage or distort the mitral valve, leading to prolapse. Now, let's understand the pathophysiology. The mitral valve, located between the left atrium and left ventricle, normally closes tightly during ventricular contraction, preventing blood from flowing backward. In MVP, the valve leaflets, which are the flaps that make up the valve, become floppy and bulge, or prolapse, back into the left atrium during this contraction. This can sometimes lead to mitral regurgitation, where blood leaks back into the atrium. The severity of regurgitation can vary, ranging from mild to severe. In severe cases, the heart has to work harder to compensate for the backflow, which can eventually lead to heart failure. Mitral valve prolapse is surprisingly common. It's estimated to affect between 1 to 3% of the population. It can occur in people of all ages, but it's more frequently diagnosed in young adults and women. Many people with MVP have no symptoms and are unaware they have the condition. It is often incidentally discovered during a routine physical examination or during tests for other conditions. Many people with mitral valve prolapse experience no symptoms at all. However, when symptoms do occur, they can vary widely. Common symptoms include palpitations, which feel like skipped heartbeats or a racing heart. Some individuals experience chest pain, which is often not related to exertion. Fatigue, shortness of breath, dizziness, and anxiety are also frequently reported. It's important to remember that these symptoms are not specific to MVP and can be caused by other conditions. If you're experiencing any of these symptoms, it's crucial to consult with a healthcare professional for proper evaluation. Diagnosing mitral valve prolapse typically starts with a physical examination. A doctor may hear a characteristic click sound, often followed by a murmur, when listening to the heart with a stethoscope. However, the primary diagnostic tool is an echocardiogram, which uses ultrasound waves to create an image of the heart. This test allows doctors to visualize the mitral valve, assess the severity of prolapse and regurgitation, and evaluate the overall function of the heart. An EKG, or electrocardiogram, may also be performed to look for any heart rhythm abnormalities. In some cases, additional tests like a stress test or transesophageal echocardiogram might be needed for a more detailed assessment. Mitral valve prolapse is generally classified based on the severity of mitral regurgitation and the morphology of the mitral valve leaflets. Regurgitation is typically graded as mild, moderate, or severe. The leaflets are assessed for thickening, redundancy, or the presence of myxomatous degeneration, which is a weakening of the valve tissue. These characteristics can help determine the risk of complications and guide treatment decisions. There are also classifications based on the mechanism of the prolapse, which can be either bileaflet or single leaflet. These distinctions help tailor treatment strategies. The treatment for mitral valve prolapse depends on the severity of the condition and the presence of symptoms. Many people with MVP don't require any specific treatment. For those with mild symptoms, lifestyle modifications such as avoiding caffeine and alcohol, managing stress, and staying well hydrated may be helpful. Medications like beta blockers can be prescribed to control palpitations and chest pain. In cases of significant mitral regurgitation, surgery to repair or replace the mitral valve may be necessary. Mitral valve repair is generally preferred over replacement, as it preserves the patient's own valve tissue. Regular follow-up with a cardiologist is essential to monitor the condition and adjust treatment as needed. While there's no guaranteed way to prevent mitral valve prolapse itself, particularly if it's genetically determined, adopting a healthy lifestyle can help manage symptoms and reduce the risk of complications. This includes maintaining a healthy weight, eating a balanced diet, exercising regularly, and avoiding smoking. If you have a family history of MVP or related connective tissue disorders, genetic counseling may be beneficial. The prognosis for most people with mitral valve prolapse is excellent. Many individuals live normal, healthy lives without any complications. However, in a small percentage of cases, MVP can lead to serious complications, such as severe mitral regurgitation, heart failure, endocarditis, or arrhythmias. Regular follow-up with a cardiologist is crucial to monitor for these complications and ensure timely intervention. Recent research has focused on improving techniques for mitral valve repair, particularly using minimally invasive approaches. Furthermore, studies are ongoing to identify the genetic factors that contribute to MVP, which could lead to more targeted therapies in the future.